Hello, I'm Dr. Ben with Salt and Light Direct Primary Care in Petersburg, Illinois. I wanted to go over some medical costs and specifically look at health shares can help stratify our risk for our health insurance costs. So let's introduce some health shares. These health shares are groups of people that agree to share their medical costs. They're technically outside of insurance and therefore don't have to abide by some of the laws restricting insurance. Many of the health shares are Christian-based ministries, and so they have lifestyle agreements or contracts in which they have some Christian moral constraints on what they will cover. Other non-Christian health shares have some sort of contract or something similar that would go over what they do and do not cover. So let's meet Dave. Dave is a 40-year-old male living in the Petersburg area, and using his age and gender, we can go to the Blue Cross Blue Shield website and see 11 different insurance plans that Blue Cross would recommend. So here's the 11 different plans. At the top, we see the difference in our monthly premium. That's what we pay the insurance company each month, as well as the deductible. So this is more out-of-pocket costs that Dave would incur before the insurance starts to kick in and paying, and then an out-of-pocket max, which would be the maximum out-of-pocket that Dave would incur for each year before insurance would take over 100%. So in the ideal pharma year, detailed as never seeing your doctor, having no prescriptions, and never getting sick, we have just the cost of the different premiums here. So this really highlights the out-of-pocket costs that you're paying to insurance companies through your monthly checks that you're sending them. We can see the difference here of the Bronze 701 plan at $5,900 compared to the $9,300 of this Gold 204 plan. On the far right here, we also see the health share and direct care relationship. And we see that Dave would save lots of money each and every year that he is perfectly healthy by having a direct primary care and health share relationship. So lots of people say that their employer pays for their medical insurance and wonder why they should pay more for a direct care doctor or even not be able to utilize that and put money towards a health share. And that's a great question. Your employer sort of pays. It's more accurately described as your employer paying on your behalf than them paying for you. If your employer takes money out of your check before they give that to you and sends that into your bank for your mortgage, it's not your employer that's paying the mortgage on your house. It's more they're paying on your behalf. So in a healthy year of Dave, we see that he visits his primary care doctor twice to get some preventative visits. And we see here also Dave can save quite a tidy sum by using a direct care and health share. We see that he's going to save about $3,600 by utilizing that combination. Here we see the blue is the premiums, the red is the out-of-pocket costs from visiting your doctor, as insurance does not kick in until you have met your deductible. In a regular year, as what I would describe of seeing your doctor for some preventative visits and then getting sick about twice, Dave has to go to the urgent care because his traditional doctor cannot get him in for acute visits, whereas with the direct care relationship, those acute visits can be managed by the primary care doctor himself. So for $930, you can get a year of direct care services with some labs and medications for your sick times. And if you pair that with the health share, you're at $3,810 for the year. And if we compare that to all of the insurance plans, we see that that can save you $4,319 a year. So in the savings that you get, you pay for the entirety of the direct care and health share relationships. So in a medically catastrophic year where you have to go constantly to the doctor, you're constantly sick, you get multiple surgeries, multiple hospital stays, this is a large sum of money that would be needed to pay for healthcare costs. So it's very important to have something to stratify your risk for those healthcare costs, like an insurance plan or a health share. So here It's more of a timeline. We have January at the top and December at the bottom, and the progression of time is in a downward fashion. So the red represents where Dave is working towards meeting his deductible. The blue is where the plan has met the deductible but not yet reached the out-of-pocket max. And then the yellow is where the out-of-pocket max has been reached and the insurance is covering the cost 100%. On the far right is the health shares and the DPC combinations. So this we see that no matter which of the health plans that Dave takes from Blue Cross Blue Shield, they all meet that out-of-pocket max at about the same time where he's getting that surgery and having that hospital stay. So no matter which of the plans, no matter how much he's paying the insurance company monthly, he's going to meet his out-of-pocket max for the year. The out-of-pocket max for the different health insurance plans was about the same. I believe it was the silver plan that had the best out-of-pocket max, and we can see that here at 7,500 for that bronze 202. That would have the least amount for Dave's year if he chose a health insurance. So here we see that the insurance is picking up $80,000 for his healthcare costs. So that really saves Dave from having to sell his entire farm. So with this graph, we see Dave's paying the blue and the red, and then the yellow is what the insurance is paying. So let's zoom in more on what Dave is having to pay, that blue and red. So here for the various plans, we see that still that direct care and health share is having the best value for Dave. He's getting a direct relationship with his doctor, being able to call and text them and notify them when he is sick and get in directly with them. And pairing that with the health share plan, he has a low monthly premium that he is paying to the health share, and they are also chipping on his health expenses quite well here in this medically catastrophic year. So with this, we see Dave saves $5,000 from having the direct care and health share plan versus just the bronze 701 plan from Blue Cross Blue Shield. For more information on how you can get set up with a direct primary care physician, you can call me directly at 217-393-8203.